Hello, nursing students. Welcome to Nursing Exam Preparation, your go-to channel for excelling in nursing exams with confidence. In today's video, we'll guide you through 150 multiple-choice questions, MCQs, on chronic kidney disease, CKD, each carefully designed to challenge your understanding and expand your knowledge of this critical topic. Detailed explanations follow every question, helping you not only answer correctly, but also grasp the reasoning behind each answer. Whether you're just beginning your studies or revising for your exams, this video is packed with content to test your skills, enhance your critical thinking, and reinforce key concepts related to chronic kidney disease. Don't forget to like this video, share it with your fellow students, and subscribe to Nursing Exam Preparation for more invaluable resources. Be sure to hit the bell icon to stay updated on our latest videos, all designed to help you succeed. Once you've completed the video, let us know your score in the comments below. We'd love to hear how you did. Let's dive in and work toward mastering chronic kidney disease and achieving exam success. 1. Which of the following is the most common cause of chronic kidney disease, CKD? A. Glomerulonephritis. B. Diabetes mellitus. C. Hypertension. D. Polycystic kidney disease. Answer: B. Diabetes mellitus. Rationale: diabetes mellitus is the leading cause of CKD, contributing to approximately 40% of cases. Hyperglycemia damages the kidney's blood vessels, leading to nephropathy. While hypertension is also a major contributor, it often develops as a result of CKD. 2. What is the primary diagnostic criterion for diagnosing CKD? A. Proteinuria. B. Elevated serum creatinine. C. Decreased glomerular filtration rate, GFR. D. Urinary retention. Answer: C. Decreased glomerular filtration rate, GFR. Rationale: a GFR of less than 60 ml/min/1.73 m superscript 2 for at least 3 months is the primary diagnostic criterion for CKD. Proteinuria can be a sign of CKD, but is not used as the sole diagnostic criterion. 3. Which stage of CKD is characterized by a GFR of 45 to 59 ml/min/1.73 m superscript 2? A. Stage 1. B. Stage 2. C. Stage 3. D. Stage 4. Answer: C. Stage 3. Rationale: Stage 3 CKD is defined by a GFR of 30 to 59 ml/min/1.73 m superscript 2, indicating moderate kidney dysfunction. Stages 1 and 2 involve higher GFRs, and Stage 4 reflects severe kidney damage with GFRs between 15 to 29 ml/min/1.73 m superscript 2. 4. A patient with CKD is experiencing hyperkalemia. Which of the following medications should the nurse anticipate to be prescribed to manage this condition? A. Furosemide, Lasix. B. Potassium-sparing diuretic. C. Sodium bicarbonate. D. Calcium gluconate. Answer: A. Furosemide, Lasix. Rationale: furosemide is a loop diuretic that helps to lower potassium levels by increasing urine output. Potassium-sparing diuretics would worsen hyperkalemia. Sodium bicarbonate helps manage acidosis, while calcium gluconate temporarily stabilizes the heart in cases of severe hyperkalemia but does not lower potassium levels. 5. What is the most common complication of CKD related to erythropoiesis? A. Anemia. B. Thrombocytosis. C. Leukopenia. D. Polycythemia. Answer: A. Anemia. Rationale: anemia is a common complication of CKD because the kidneys produce less erythropoietin, a hormone necessary for red blood cell production. Thrombocytosis and leukopenia are not common in CKD, and polycythemia would be rare in this condition. 6. Which of the following is an early clinical sign of CKD? A. Jaundice. B. Ankle edema. C. Decreased urine output. D. Itchy skin, pruritus. Answer: B. Ankle edema. Rationale: ankle edema often occurs in the early stages of CKD due to fluid retention. Decreased urine output and pruritus may appear later as the disease progresses. Jaundice is more common in liver dysfunction. 7. In CKD, what electrolyte imbalance is commonly observed due to impaired kidney function? A. Hypocalcemia. B. Hypercalcemia. C. Hypernatremia. D. Hyponatremia. Answer: A. Hypocalcemia. Rationale: the kidneys play a key role in activating vitamin D, which helps with calcium absorption. In CKD, impaired kidney function leads to decreased calcium levels and an imbalance in phosphate, contributing to bone mineral disorders. 8. Which medication is commonly used to manage hyperphosphatemia in CKD patients? A. Sodium bicarbonate. B. Calcium carbonate. C. Furosemide. D. Enalapril. Answer: B. Calcium carbonate. Rationale: calcium carbonate is a phosphate binder commonly used to manage hyperphosphatemia in CKD patients. Sodium bicarbonate helps correct metabolic acidosis, furosemide is a diuretic, and enalapril is an ACE inhibitor. 9. A patient with CKD is prescribed a low-protein diet. Which of the following is the most important reason for this recommendation? A. To decrease phosphorus levels. B. To reduce nitrogenous waste buildup. C. To manage blood pressure. D. To enhance erythropoiesis. Answer: B. To reduce nitrogenous waste buildup. Rationale: reducing protein intake helps decrease the production of nitrogenous waste products, which the kidneys are unable to excrete efficiently in CKD. While managing phosphorus and blood pressure is important, the primary goal is to reduce the burden on the kidneys. 10. Which of the following findings would be expected in a patient with end-stage renal disease, ESRD? A. Normal creatinine levels. B. GFR greater than 90 ml/min/1.73 m superscript 2. C. Elevated blood urea nitrogen, BUN. D. Decreased potassium levels. Answer: C. Elevated blood urea nitrogen, BUN. Rationale: in ESRD, kidney function is severely impaired, leading to an accumulation of waste products like BUN and creatinine. A GFR of greater than 90 ml/min/1.73 m superscript 2 would indicate normal kidney function, and potassium levels could be elevated due to impaired excretion. 11. What is the most common type of dialysis used for patients with end-stage renal disease? A. Peritoneal dialysis. B. Hemodialysis. C. Continuous renal replacement therapy. D. Intermittent hemodialysis. Answer: B. Hemodialysis. Rationale: hemodialysis is the most commonly used form of dialysis for patients with ESRD. Peritoneal dialysis is an alternative, but it is less commonly used. Continuous renal replacement therapy is typically used in critically ill patients with acute kidney injury. 12. A patient with CKD has a serum creatinine level of 3.0 mg per deciliter. Which of the following is the most appropriate next step? A. Encourage increased fluid intake. B. Assess for signs of dehydration. C. Monitor for symptoms of uremia. D. Discontinue all medications. Answer: C. Monitor for symptoms of uremia. Rationale: a serum creatinine level of 3.0 mg per deciliter indicates moderate kidney dysfunction. Monitoring for symptoms of uremia, such as nausea, vomiting, and fatigue, is essential. Increasing fluid intake may not be appropriate in CKD due to fluid retention. 13. What is a common side effect of erythropoiesis-stimulating agents, ESAs, in CKD patients? A. Hyperkalemia. B. Hypertension. C. Hypotension. D. Hypokalemia. Answer: B. Hypertension. Rationale: erythropoiesis-stimulating agents, ESAs, such as epoetin alpha can increase red blood cell production, which may lead to hypertension. This is due to the increased blood volume from more circulating red blood cells. 14. Which of the following is a priority nursing intervention for a patient with CKD who has fluid overload? A. Increase potassium intake. B. Administer 4 fluids. C. Restrict sodium intake. D. Encourage high-protein meals. Answer: C. Restrict sodium intake. Rationale: sodium restriction is essential in managing fluid overload in CKD because sodium causes water retention. Administering 4 fluids would worsen fluid overload. High-protein meals are not recommended in CKD due to the need to limit nitrogenous waste production. 15. A patient with CKD is at risk for bone mineral disorders. Which of the following would the nurse monitor closely in this patient? A. Vitamin B12 levels. B. Serum phosphate and calcium levels. C. Hemoglobin and hematocrit levels. D. Potassium and sodium levels. Answer: B. Serum phosphate and calcium levels. Rationale: CKD disrupts calcium and phosphate balance, leading to bone mineral disorders. Monitoring serum phosphate and calcium levels is crucial. Vitamin B12 and hematocrit levels are not directly affected by CKD in this context. 16. What is the most appropriate action for a nurse when a patient with CKD exhibits signs of uremic frost? A. Administer a diuretic. B. Increase fluid intake. C. Prepare for dialysis. D. Provide skin care products. Answer: C. Prepare for dialysis. Rationale: uremic frost is a sign of severe uremia, which indicates advanced kidney failure. Dialysis is typically required to remove toxins from the blood. Increasing fluid intake may worsen fluid overload. 17. Which of the following laboratory values would indicate that a patient with CKD is in stage 4? A. GFR 90 ml/min/1.73 m superscript 2. B. GFR 30 ml/min/1.73 m superscript 2. C. Serum creatinine 1.2 mg per deciliter. D. Serum potassium 3.2 milliequivalents/L. Answer: B. GFR 30 ml/min/1.73 m superscript 2. Rationale: Stage 4 CKD is defined by a GFR of 15 to 29 ml/min/1.73 m superscript 2. A GFR of 30 ml/min/1.73 m superscript 2 falls at the upper limit of stage 4. Serum creatinine and potassium levels may vary depending on the stage, but are not definitive for staging. 18. Which of the following is an appropriate nursing intervention for a patient with CKD and pruritus, itchy skin? A. Apply moisturizing lotions. B. Administer antibiotics. C. Encourage hot showers. D. Apply topical steroids. Answer: A. Apply moisturizing lotions. Rationale: pruritus in CKD is often caused by the accumulation of waste products in the skin. Moisturizing lotions can help soothe the skin and reduce itching. Hot showers can worsen dryness, and antibiotics are not indicated unless infection is present. 19. A patient with CKD and hypertension is prescribed an ACE inhibitor. What is the most important nursing assessment for this patient? A. Assess lung sounds for crackles. B. Monitor blood pressure regularly. C. Evaluate for signs of hyperkalemia. D. Monitor for signs of bleeding. Answer: C. Evaluate for signs of hyperkalemia. Rationale: ACE inhibitors can increase potassium levels, so it's important to monitor for hyperkalemia. While blood pressure should be monitored, hyperkalemia is a primary concern with ACE inhibitors in CKD patients. 20. A patient with CKD is on a phosphorus binder. Which of the following should the nurse instruct the patient? A. Take the medication with meals. B. Take the medication before meals. C. Increase fluid intake after taking the medication. D. Take the medication with calcium supplements. Answer: A. Take the medication with meals. Rationale: phosphorus binders should be taken with meals to reduce phosphate absorption from food. Taking the medication before meals or with calcium supplements is not recommended without specific instructions. 21. Which of the following would be a concern when administering a loop diuretic to a patient with CKD? A. Risk of hypokalemia. B. Increased uric acid levels. C. Elevated creatinine levels. D. Risk of hypercalcemia. Answer: A. Risk of hypokalemia. Rationale: loop diuretics like furosemide can cause potassium loss, leading to hypokalemia, which is a concern in CKD patients. While elevated creatinine levels are expected in CKD, the diuretic-induced potassium loss is the primary concern. 22. What is the goal of pharmacological management in the early stages of CKD? A. To delay disease progression. B. To cure the disease. C. To reverse kidney damage. D. To eliminate the need for dialysis. Answer: A. To delay disease progression. Rationale: the main goal in the early stages of CKD is to slow or halt the progression of kidney damage through medication and lifestyle changes. There is no cure for CKD, and dialysis is avoided as long as possible. 23. Which of the following is a common finding in a urinalysis for a patient with CKD? A. Increased specific gravity. B. Proteinuria. C. Blood in the urine. D. Glucosuria. Answer: B. Proteinuria. Rationale: proteinuria is a hallmark of CKD and indicates kidney damage. Increased specific gravity is more common in dehydration. Blood in the urine and glucosuria are not specific to CKD. 24. A patient with CKD is at risk for developing metabolic acidosis. Which of the following interventions would help correct this condition? A. Administer sodium bicarbonate. B. Restrict sodium intake. C. Administer calcium carbonate. D. Increase fluid intake. Answer: A. Administer sodium bicarbonate. Rationale: sodium bicarbonate is commonly used to correct metabolic acidosis in CKD patients. Restricting sodium, administering calcium carbonate, and increasing fluid intake are not directly effective for treating acidosis. 25. What is the most important nursing intervention for a patient with CKD and anemia? A. Encourage iron-rich foods. B. Monitor for signs of bleeding. C. Administer erythropoiesis-stimulating agents. D. Restrict potassium intake. Answer: C. Administer erythropoiesis-stimulating agents. Rationale: erythropoiesis-stimulating agents, ESAs, are used to treat anemia in CKD by stimulating red blood cell production. While iron-rich foods may help, ESAs are the primary treatment for anemia in CKD. 26. What is the primary purpose of using angiotensin-converting enzyme, ACE, inhibitors in CKD patients? A. To reduce proteinuria. B. To lower blood pressure. C. To reduce potassium levels. D. To increase urine output. Answer: A. To reduce proteinuria. Rationale: ACE inhibitors are commonly used in CKD patients to reduce proteinuria, which can help slow the progression of kidney damage. While they also lower blood pressure, their primary role in CKD is related to proteinuria reduction. 27. Which of the following is a common symptom of uremia in patients with CKD? A. Increased appetite. B. Dry mouth. C. Nausea and vomiting. D. Increased energy levels. Answer: C. Nausea and vomiting. Rationale: uremia, caused by the accumulation of waste products in the blood, can lead to symptoms such as nausea and vomiting. Dry mouth is a symptom of fluid imbalance, while increased energy and appetite are not common in uremia. 28. A patient with CKD is prescribed a potassium-sparing diuretic. Which of the following is the most important intervention for this patient? A. Encourage high potassium foods. B. Monitor for signs of hyperkalemia. C. Restrict fluid intake. D. Administer the diuretic in the morning. Answer: B. Monitor for signs of hyperkalemia. Rationale: potassium-sparing diuretics can cause hyperkalemia, so it's essential to monitor potassium levels closely. High potassium foods should be avoided, not encouraged, to prevent further elevation in potassium levels. 29. Which of the following is a common complication of CKD related to bone health? A. Osteoporosis. B. Osteomalacia. C. Bone mineral density, BMD, increase. D. Osteoarthritis. Answer: B. Osteomalacia. Rationale: osteomalacia, or softening of the bones, is a common complication of CKD due to impaired calcium and phosphate metabolism. Osteoporosis can also occur, but osteomalacia is more specifically related to CKD. 30. A patient with CKD is experiencing severe fatigue. Which of the following is the most likely cause of this symptom? A. Hyperkalemia. B. Anemia. C. Hypertension. D. Hypercalcemia. Answer: B. Anemia. Rationale: Anemia is a common cause of fatigue in CKD due to decreased erythropoietin production. While hyperkalemia can lead to muscle weakness, anemia is the more likely cause of fatigue. 31. What is the role of a nephrologist in the care of a patient with CKD? A. Prescribe pain management medications. B. Monitor fluid and electrolyte imbalances. C. Provide psychological counseling. D. Perform dialysis treatments. Answer: B. Monitor fluid and electrolyte imbalances. Rationale: a nephrologist specializes in managing kidney disease, including monitoring and correcting fluid and electrolyte imbalances. Pain management and psychological counseling are usually handled by other specialists. 32. A patient with CKD is prescribed phosphate binders. When should these medications be taken? A. Before meals. B. With meals. C. After meals. D. At bedtime. Answer: B. With meals. Rationale: phosphate binders should be taken with meals to reduce phosphate absorption from food. Taking them before or after meals would reduce their effectiveness. 33. Which of the following is an appropriate dietary recommendation for a patient with CKD? A. Increase protein intake. B. Increase sodium intake. C. Restrict potassium intake. D. Increase fluid intake. Answer: C. Restrict potassium intake. Rationale: potassium restriction is often necessary in CKD because the kidneys are unable to excrete excess potassium effectively, leading to a risk of hyperkalemia. Protein and sodium should also be restricted, but potassium restriction is a key part of managing CKD. 34. A patient with CKD is at risk for metabolic acidosis. What laboratory result would indicate this condition? A. Low bicarbonate levels. B. High bicarbonate levels. C. Elevated pH. D. Decreased blood urea nitrogen (BUN). Answer: A. Low bicarbonate levels. Rationale: metabolic acidosis is commonly seen in CKD due to the kidney's inability to excrete acid. Low bicarbonate levels are a hallmark of metabolic acidosis. Elevated pH and decreased BUN are not consistent with acidosis. 35. A patient with CKD is experiencing fluid overload. What is the most appropriate nursing action? A. Restrict sodium and water intake. B. Increase potassium intake. C. Encourage excessive fluid intake. D. Discontinue all medications. Answer: A. Restrict sodium and water intake. Rationale: fluid overload is managed by restricting both sodium and water intake to reduce fluid retention. Excessive fluid intake or increased potassium intake would exacerbate the condition. 36. What is the primary role of dialysis in the management of CKD? A. To cure kidney disease. B. To remove waste products from the blood. C. To improve kidney function. D. To regulate blood pressure. Answer: B. To remove waste products from the blood. Rationale: dialysis is used to remove waste products, excess fluids, and electrolytes from the blood when the kidneys can no longer perform this function. It does not cure CKD or improve kidney function, but it helps manage symptoms and prevent complications. 37. A patient with CKD has a GFR of 50 milliliters per minute. What is the most appropriate classification for this patient's CKD stage? A. Stage 1. B. Stage 2. C. Stage 3. D. Stage 4. Answer: C. Stage 3. Rationale: Stage 3 CKD is characterized by a GFR between 30 to 59 ml/min. A GFR of 50 milliliters per minute indicates moderate kidney dysfunction. Stages 1 and 2 involve higher GFRs, while stage 4 reflects more severe kidney damage. 38. A patient with CKD has been prescribed an iron supplement. What is the most common side effect of this medication? A. Nausea. B. Diarrhea. C. Constipation. D. Headache. Answer: C. Constipation. Rationale: iron supplements commonly cause constipation as a side effect. Patients should be advised to drink plenty of fluids and, if necessary, use a stool softener to alleviate this issue. 39. What is the priority nursing assessment for a patient with CKD and anemia? A. Assess for signs of infection. B. Monitor for signs of bleeding. C. Evaluate respiratory function. D. Assess for signs of hypoxia. Answer: D. Assess for signs of hypoxia. Rationale: anemia in CKD leads to reduced oxygen-carrying capacity of the blood, which can result in hypoxia. Monitoring for hypoxia is crucial in managing anemia. While infection and bleeding are concerns, hypoxia is the immediate priority. 40. A patient with CKD is experiencing pruritus. What should the nurse recommend to manage the symptom? A. Apply lotion to the skin. B. Take an antihistamine. C. Take a hot shower. D. Use soap to dry the skin. Answer: A. Apply lotion to the skin. Rationale: pruritus in CKD is often caused by the accumulation of waste products in the skin. Applying moisturizing lotion can help soothe and hydrate the skin, reducing itching. Hot showers and soap can worsen the condition. 41. A patient with CKD has an elevated creatinine level. What is the significance of this finding? A. It indicates liver dysfunction. B. It indicates impaired kidney function. C. It suggests hyperkalemia. D. It suggests anemia. Answer: B. It indicates impaired kidney function. Rationale: elevated creatinine levels are a key indicator of impaired kidney function. Creatinine is a waste product filtered by the kidneys, and when kidney function declines, creatinine levels rise. 42. A patient with CKD is prescribed calcium carbonate. What is the primary purpose of this medication? A. To reduce blood pressure. B. To treat hypercalcemia. C. To bind phosphate in the gastrointestinal tract. D. To increase erythropoietin production. Answer: C. To bind phosphate in the gastrointestinal tract. Rationale: calcium carbonate is used as a phosphate binder in CKD to prevent the absorption of excess phosphate from the gastrointestinal tract. It is not used to treat hypercalcemia or increase erythropoietin. 43. What is a common cause of hypertension in patients with CKD? A. Fluid retention. B. Hypokalemia. C. Hypercalcemia. D. Increased erythropoiesis. Answer: A. Fluid retention. Rationale: fluid retention, common in CKD, increases blood volume, leading to hypertension. While other factors may also contribute to hypertension, fluid retention is the most common cause. 44. A patient with CKD is experiencing nausea and vomiting. What is the priority intervention? A. Provide antiemetic medications. B. Increase fluid intake. C. Administer a phosphate binder. D. Encourage high-protein meals. Answer: A. Provide antiemetic medications. Rationale: nausea and vomiting are common symptoms of uremia in CKD, and antiemetic medications can help alleviate these symptoms. Increasing fluid intake could worsen fluid retention, and phosphate binders and high-protein meals are not appropriate for the symptom. 45. A patient with CKD requires education about the importance of managing blood pressure. What is the most important reason for controlling blood pressure in CKD? A. To prevent proteinuria. B. To prevent hyperkalemia. C. To prevent fluid retention. D. To slow the progression of kidney damage. Answer: D. To slow the progression of kidney damage. Rationale: high blood pressure accelerates kidney damage in CKD, so controlling blood pressure is key to slowing the progression of the disease. While managing proteinuria and fluid retention is important, the primary goal is to protect kidney function. 46. A patient with CKD is prescribed a diuretic. Which of the following is the most important nursing consideration? A. Assess for signs of hyperkalemia. B. Monitor for signs of dehydration. C. Encourage increased fluid intake. D. Administer the diuretic at bedtime. Answer: B. Monitor for signs of dehydration. Rationale: diuretics can cause dehydration, so it's essential to monitor for signs such as dry mouth, dizziness, and decreased urine output. While potassium levels should be monitored, dehydration is a primary concern when administering diuretics. 47. A patient with CKD is prescribed erythropoiesis-stimulating agents, ESAs. What is the primary goal of this treatment? A. To improve blood pressure control. B. To increase red blood cell production. C. To prevent bone fractures. D. To regulate potassium levels. Answer: B. To increase red blood cell production. Rationale: erythropoiesis-stimulating agents, ESAs, are used to increase red blood cell production in CKD patients with anemia. They are not used to control blood pressure, prevent bone fractures, or regulate potassium levels. 48. Which of the following signs would indicate that a patient with CKD is developing hyperkalemia? A. Muscle weakness and irregular pulse. B. Hypertension and headache. C. Increased urination and fatigue. D. Jaundice and dark urine. Answer: A. Muscle weakness and irregular pulse. Rationale: hyperkalemia, a common complication of CKD, can cause muscle weakness and an irregular pulse due to the effect of elevated potassium levels on the heart and muscles. Other symptoms like jaundice and increased urination are not typically associated with hyperkalemia. 49. What is the purpose of administering a phosphate binder to a patient with CKD? A. To reduce serum calcium levels. B. To prevent bone mineral density loss. C. To reduce serum phosphate levels. D. To increase vitamin D activation. Answer: C. To reduce serum phosphate levels. Rationale: phosphate binders are used in CKD to reduce elevated phosphate levels, which can lead to bone mineral disorders. They do not directly affect calcium levels or vitamin D activation. 50. A patient with CKD is at risk for fluid volume overload. Which of the following would the nurse prioritize monitoring? A. Intake and output, INO. B. Blood glucose levels. C. Serum albumin levels. D. Serum creatinine levels. Answer: A. Intake and output, INO. Rationale: monitoring intake and output, INO, is essential for patients at risk for fluid overload to assess the balance between fluid intake and excretion. Serum creatinine and albumin levels are important, but not as directly related to fluid balance. 51. A patient with CKD is prescribed a low-sodium diet. What is the primary reason for this recommendation? A. To prevent potassium retention. B. To reduce the risk of fluid retention. C. To increase calcium absorption. D. To prevent hyperphosphatemia. Answer: B. To reduce the risk of fluid retention. Rationale: a low-sodium diet is essential in managing fluid balance in CKD, as excess sodium leads to fluid retention. While controlling potassium and phosphate are important, fluid retention is the primary concern. 52. What is the most common cause of CKD in the United States? A. Polycystic kidney disease. B. Glomerulonephritis. C. Hypertension. D. Diabetes mellitus. Answer: D. Diabetes mellitus. Rationale: diabetes mellitus is the leading cause of CKD in the United States, contributing to kidney damage through hyperglycemia and increased pressure on the kidney's filtration system. Hypertension is also a major cause, but diabetes is more prevalent. 53. A patient with CKD has a GFR of 20 milliliters per minute. What is the appropriate stage for this patient's CKD? A. Stage 1. B. Stage 2. C. Stage 3. D. Stage 4. Answer: D. Stage 4. Rationale: a GFR of 20 milliliters per minute indicates stage 4 CKD, which is characterized by severe kidney dysfunction. Stage 3 includes GFRs between 30 and 59 milliliters per minute. Stage 5 is defined by a GFR of less than 15 milliliters per minute. 54. A patient with CKD is experiencing itchy skin. What is the most appropriate intervention? A. Increase fluid intake. B. Apply moisturizing creams. C. Administer antihistamines. D. Provide cool baths with salt. Answer: B. Apply moisturizing creams. Rationale: pruritus in CKD is due to the accumulation of waste products in the skin. Moisturizing creams can help alleviate dryness and itching. Fluid intake should be monitored in CKD patients, and antihistamines may not be effective. 55. What is the role of aldosterone in CKD? A. To promote sodium and water retention. B. To increase potassium excretion. C. To stimulate red blood cell production. D. To activate vitamin D. Answer: A. To promote sodium and water retention. Rationale: aldosterone promotes sodium and water retention, which can contribute to fluid overload in CKD patients. It also increases potassium excretion, which can lead to hypokalemia. It does not have a direct effect on red blood cell production or vitamin D activation. 56. A patient with CKD is at risk for anemia. What is the primary cause of anemia in CKD? A. Decreased production of erythropoietin. B. Increased blood loss. C. Poor dietary intake of iron. D. Excessive breakdown of red blood cells. Answer: A. Decreased production of erythropoietin. Rationale: in CKD, the kidneys produce less erythropoietin, a hormone that stimulates red blood cell production. As a result, anemia is a common complication of CKD. Iron deficiency and blood loss may contribute, but decreased erythropoietin production is the primary cause. 57. A patient with CKD is prescribed a potassium-sparing diuretic. What is the most important nursing action? A. Monitor for signs of hypokalemia. B. Educate the patient about avoiding high potassium foods. C. Monitor serum potassium levels regularly. D. Administer the diuretic before meals. Answer: C. Monitor serum potassium levels regularly. Rationale: potassium-sparing diuretics can increase potassium levels, so it is crucial to monitor serum potassium levels regularly to prevent hyperkalemia. High potassium foods should be avoided, but the primary concern is monitoring potassium levels. 58. What is the purpose of using diuretics in CKD patients? A. To increase red blood cell production. B. To reduce fluid retention. C. To correct electrolyte imbalances. D. To lower blood glucose levels. Answer: B. To reduce fluid retention. Rationale: diuretics are used in CKD patients to help remove excess fluid from the body, reducing symptoms of fluid retention such as edema and hypertension. They do not directly affect red blood cell production or blood glucose levels. 59. A patient with CKD is prescribed calcium carbonate as a phosphate binder. When should this medication be taken? A. Before meals. B. With meals. C. After meals. D. At bedtime. Answer: B. With meals. Rationale: phosphate binders such as calcium carbonate should be taken with meals to bind phosphate from food and reduce its absorption. Taking them before or after meals reduces their effectiveness. 60. A patient with CKD is experiencing nausea, vomiting, and fatigue. What is the most likely cause of these symptoms? A. Uremia. B. Hyperkalemia. C. Hypercalcemia. D. Anemia. Rationale: nausea, vomiting, and fatigue are common symptoms of uremia, which occurs when the kidneys can no longer filter waste products effectively. These symptoms are related to the accumulation of toxins in the blood. 61. A patient with CKD is undergoing hemodialysis. What is the primary purpose of this treatment? A. To increase urine output. B. To remove excess fluid and waste products. C. To correct electrolyte imbalances. D. To stimulate red blood cell production. Answer: B. To remove excess fluid and waste products. Rationale: hemodialysis is used to remove excess fluid, waste products, and toxins from the blood when the kidneys are unable to perform this function. It does not directly increase urine output or stimulate red blood cell production. 62. A patient with CKD is receiving a blood transfusion. What is the nurse's priority concern? A. Risk of infection. B. Risk of hyperkalemia. C. Risk of fluid overload. D. Risk of allergic reaction. Answer: C. Risk of fluid overload. Rationale: patients with CKD are at risk for fluid overload, and blood transfusions can exacerbate this condition. While infection, hyperkalemia, and allergic reactions are concerns, fluid overload is the most immediate concern in CKD patients. 63. A patient with CKD has a potassium level of 6.5 milliequivalent/L. What is the priority nursing action? A. Administer potassium supplements. B. Hold potassium-sparing diuretics. C. Prepare for dialysis. D. Administer sodium bicarbonate. Answer: C. Prepare for dialysis. Rationale: a potassium level of 6.5 milliequivalent/L is dangerously high and can lead to cardiac arrhythmias. Dialysis may be necessary to remove excess potassium. Potassium-sparing diuretics should be held, and potassium supplements should not be given. 64. A patient with CKD is experiencing difficulty breathing. Which of the following complications is the most likely cause of this symptom? A. Pulmonary edema. B. Hyperkalemia. C. Anemia. D. Uremic pleuritis. Answer: A. Pulmonary edema. Rationale: pulmonary edema is a common complication of CKD due to fluid overload, causing difficulty breathing. Hyperkalemia and anemia can also cause symptoms, but difficulty breathing is most often due to fluid retention. 65. Which of the following is the most common electrolyte imbalance in CKD patients? A. Hypokalemia. B. Hypernatremia. C. Hyperkalemia. D. Hypocalcemia. Answer: C. Hyperkalemia. Rationale: hyperkalemia is a common and serious electrolyte imbalance in CKD due to impaired potassium excretion. Hypokalemia and hypernatremia are less common, and hypocalcemia can occur, but is not as frequent as hyperkalemia. 66. A patient with CKD is on a low-protein diet. What is the rationale for this dietary restriction? A. To prevent fluid overload. B. To reduce urea production. C. To increase red blood cell production. D. To prevent bone mineral loss. Answer: B. To reduce urea production. Rationale: a low-protein diet is often recommended for CKD patients to reduce urea production, as the kidneys are less able to filter waste products like urea. This helps minimize the buildup of waste in the blood and prevent uremia. 67. A patient with CKD has been prescribed a phosphate binder. Which of the following is the most important nursing consideration? A. Administer it with a meal. B. Administer it on an empty stomach. C. Monitor for hypokalemia. D. Monitor for increased blood pressure. Answer: A. Administer it with a meal. Rationale: phosphate binders should be taken with meals to help bind dietary phosphate and prevent its absorption. Taking them on an empty stomach reduces their effectiveness. Monitoring for hypokalemia is not the primary concern with phosphate binders. 68. What is the most common manifestation of acute kidney injury, AKI, in a patient with underlying CKD? A. Oliguria. B. Polyuria. C. Hematuria. D. Fever. Answer: A. Oliguria. Rationale: oliguria, or reduced urine output, is the most common manifestation of AKI in patients with CKD. AKI may worsen kidney function and cause further complications. Polyuria is less common, and fever is not a typical symptom of AKI. 69. A patient with CKD is taking an angiotensin-converting enzyme, ACE, inhibitor. What is the most important nursing action? A. Monitor for hypotension. B. Monitor for hyperkalemia. C. Monitor for tachycardia. D. Administer with food. Answer: B. Monitor for hyperkalemia. Rationale: ACE inhibitors can cause hyperkalemia, so monitoring potassium levels is crucial. While hypotension may occur, hyperkalemia is the more critical side effect in CKD patients. ACE inhibitors can be taken with or without food. 70. What laboratory value is most indicative of the severity of CKD? A. Serum potassium. B. Serum creatinine. C. Hemoglobin level. D. Bicarbonate level. Answer: B. Serum creatinine. Rationale: serum creatinine is a key indicator of kidney function. Elevated creatinine levels reflect the kidney's reduced ability to clear waste products. While potassium, hemoglobin, and bicarbonate levels are important in CKD management, creatinine is the most direct measure of kidney function. 71. A patient with CKD has developed anemia. Which of the following interventions is most appropriate? A. Administer erythropoiesis-stimulating agents, ESAs. B. Increase dietary iron. C. Increase vitamin B12 intake. D. Administer blood transfusions. Answer: A. Administer erythropoiesis-stimulating agents, ESAs. Rationale: Anemia in CKD is primarily due to decreased erythropoietin production, so ESAs are used to stimulate red blood cell production. Iron supplementation may be necessary, but ESAs are the first-line treatment for CKD-related anemia. 72. A patient with CKD is at risk for developing metabolic acidosis. Which of the following laboratory findings is consistent with this condition? A. Low pH and low bicarbonate. B. High pH and high bicarbonate. C. Low pH and high bicarbonate. D. High pH and low bicarbonate. Answer: A. Low pH and low bicarbonate. Rationale: metabolic acidosis is characterized by a low pH and low bicarbonate levels. The kidneys are unable to excrete acid, leading to an accumulation of hydrogen ions and a reduction in bicarbonate. 73. A patient with CKD is being started on a low-potassium diet. Which of the following foods should the nurse recommend? A. Bananas. B. Oranges. C. Apples. D. Potatoes. Answer: C. Apples. Rationale: apples are a low-potassium fruit and are a good option for patients with CKD. Bananas, oranges, and potatoes are high in potassium and should be avoided or limited in a low-potassium diet. 74. Which of the following is the most appropriate intervention for a patient with CKD and fluid overload? A. Administer a potassium-sparing diuretic. B. Increase fluid intake. C. Restrict sodium and fluid intake. D. Provide a high-protein diet. Answer: C. Restrict sodium and fluid intake. Rationale: restricting sodium and fluid intake is essential to manage fluid overload in CKD patients. Potassium-sparing diuretics should be used cautiously in CKD. A high-protein diet is contraindicated in advanced CKD due to the kidney's inability to excrete nitrogenous wastes. 75. What is the most appropriate nursing action for a patient with CKD who is scheduled for dialysis? A. Monitor for fluid volume overload. B. Ensure the patient has fasted for 12 hours. C. Assess the access site for patency. D. Administer potassium supplements. Answer: C. Assess the access site for patency. Rationale: assessing the dialysis access site for patency, such as a fistula or catheter, is crucial to ensure proper dialysis. Fluid overload may be addressed post-dialysis, and potassium supplements are usually not given before dialysis. Fasting is not required before dialysis. 76. A patient with CKD is diagnosed with hyperphosphatemia. What is the best dietary recommendation? A. Increase intake of dairy products. B. Decrease intake of high-phosphate foods. C. Increase intake of meat and fish. D. Limit fluid intake. Answer: B. Decrease intake of high-phosphate foods. Rationale: in CKD, phosphate levels can rise due to the kidney's inability to excrete phosphate. Decreasing high-phosphate foods like dairy, meat, and fish helps control serum phosphate levels. 77. A patient with CKD is prescribed a sodium bicarbonate solution for metabolic acidosis. What is the expected outcome of this treatment? A. Increase in serum calcium levels. B. Neutralization of excess hydrogen ions. C. Decrease in potassium levels. D. Increase in red blood cell production. Answer: B. Neutralization of excess hydrogen ions. Rationale: sodium bicarbonate neutralizes excess hydrogen ions in the blood, helping to correct metabolic acidosis. It does not directly affect calcium, potassium, or red blood cell production. 78. Which of the following laboratory findings is most indicative of kidney failure in CKD patients? A. Decreased glomerular filtration rate, GFR. B. Increased serum albumin levels. C. Increased white blood cell count. D. Decreased serum creatinine. Answer: A. Decreased glomerular filtration rate, GFR. Rationale: a decreased GFR is a key indicator of kidney failure. Serum albumin and white blood cell count are not specific markers for kidney failure, and serum creatinine typically increases with worsening kidney function. 79. What is the most common cause of death in patients with advanced CKD? A. Infection. B. Cardiovascular disease. C. Hyperkalemia. D. Uremia. Answer: B. Cardiovascular disease. Rationale: cardiovascular disease is the leading cause of death in advanced CKD due to the effects of fluid overload, hypertension, and the metabolic changes that occur in kidney dysfunction. Infection is also a concern but is less common than cardiovascular issues in advanced CKD. 80. A patient with CKD is scheduled for a kidney transplant. What is the most important preoperative teaching for the patient? A. The importance of avoiding fluid restriction. B. The need for lifelong immunosuppressive therapy. C. The need for increased sodium intake. D. The importance of increased potassium intake. Answer: B. The need for lifelong immunosuppressive therapy. Rationale: after a kidney transplant, patients require lifelong immunosuppressive therapy to prevent rejection of the transplanted kidney. Fluid, sodium, and potassium intake are typically managed according to the patient's specific needs and kidney function. 81. A patient with CKD is prescribed an erythropoiesis-stimulating agent, ESA. What is the most important monitoring parameter? A. Hemoglobin level. B. Serum potassium. C. White blood cell count. D. Blood glucose level. Answer: A. Hemoglobin level. Rationale: ESAs are used to treat anemia in CKD by stimulating red blood cell production. Hemoglobin levels should be closely monitored to assess the effectiveness of the treatment. Potassium, white blood cell count, and blood glucose are not the primary parameters for ESA therapy. 82. A patient with CKD is receiving hemodialysis. What is the most important nursing action after dialysis? A. Assess for hypotension and dizziness. B. Increase dietary intake of potassium. C. Monitor for respiratory distress. D. Provide 4 fluids. Answer: A. Assess for hypotension and dizziness. Rationale: after hemodialysis, patients are at risk for hypotension and dizziness due to rapid fluid shifts. Monitoring for these signs is crucial. Increasing potassium intake and providing fluids are not typically indicated after dialysis unless there are specific complications. 83. A patient with CKD is experiencing persistent nausea and vomiting. Which of the following interventions is most appropriate? A. Administer antiemetic medications. B. Increase fluid intake. C. Administer phosphate binders. D. Provide a high-protein diet. Answer: A. Administer antiemetic medications. Rationale: nausea and vomiting in CKD are often due to uremia. Antiemetic medications can help manage these symptoms. Increasing fluid intake can worsen fluid overload, and phosphate binders and high-protein diets are not appropriate for managing nausea. 84. A patient with CKD is at risk for developing cardiovascular complications. Which of the following is the most appropriate intervention? A. Administer diuretics to reduce blood pressure. B. Encourage a low-protein diet. C. Encourage smoking cessation and exercise. D. Increase sodium intake to promote circulation. Answer: C. Encourage smoking cessation and exercise. Rationale: smoking cessation and regular exercise are key to reducing cardiovascular risk in CKD patients. Diuretics can help manage fluid overload and blood pressure, but lifestyle changes are critical for long-term cardiovascular health. 85. A patient with CKD has a serum calcium level of 7.2 milligrams per deciliter. What is the most appropriate intervention? A. Administer calcium supplements. B. Encourage a high-phosphate diet. C. Monitor for signs of hyperkalemia. D. Administer vitamin D. Answer: A. Administer calcium supplements. Rationale: low calcium levels in CKD can lead to bone mineral disorders. Administering calcium supplements may help correct the deficiency. A high-phosphate diet is contraindicated in CKD, and monitoring for hyperkalemia is unrelated to calcium levels. 86. A patient with CKD is experiencing fatigue. Which of the following is the most likely cause of this symptom? A. Anemia. B. Hyperkalemia. C. Fluid overload. D. Uremia. Answer: A. Anemia. Rationale: fatigue in CKD patients is often caused by anemia due to decreased erythropoietin production. While hyperkalemia, fluid overload, and uremia can also cause symptoms, anemia is the most common cause of fatigue in CKD. 87. A patient with CKD is prescribed sodium polystyrene sulfonate, KXL8. What is the primary purpose of this medication? A. To lower potassium levels. B. To reduce phosphate levels. C. To treat anemia. D. To prevent fluid overload. Answer: A. To lower potassium levels. Rationale: sodium polystyrene sulfonate is used to treat hyperkalemia by exchanging potassium for sodium in the intestines, helping to lower serum potassium levels. It does not affect phosphate, anemia, or fluid overload directly. 88. A patient with CKD is prescribed a calcium channel blocker. What is the primary reason for using this medication? A. To treat hypertension. B. To reduce hyperphosphatemia. C. To stimulate erythropoiesis. D. To increase urine output. Answer: A. To treat hypertension. Rationale: calcium channel blockers are commonly used to treat hypertension in CKD patients. They do not have a significant effect on phosphate levels, erythropoiesis, or urine output. 89. A patient with CKD is being started on dialysis. Which of the following is a common complication during the early stages of dialysis? A. Hypotension. B. Hyperkalemia. C. Hypoglycemia. D. Hyperphosphatemia. Answer: A. Hypotension. Rationale: hypotension is a common complication during the early stages of dialysis due to rapid fluid removal. Hyperkalemia, hypoglycemia, and hyperphosphatemia may be concerns in CKD, but are less common during the initial stages of dialysis. 90. A patient with CKD is prescribed erythropoiesis-stimulating agents, ESAs, for anemia. What is the most important side effect to monitor for in this patient? A. Hypertension. B. Hyperkalemia. C. Hypokalemia. D. Hypotension. Answer: A. Hypertension. Rationale: ESAs can cause an increase in blood pressure, so monitoring for hypertension is essential. Hyperkalemia, hypokalemia, and hypotension are not typical side effects of ESAs. 91. A patient with CKD is experiencing pruritus. Which of the following is the most likely cause of this symptom? A. Hyperphosphatemia. B. Hypocalcemia. C. Anemia. D. Uremia. Answer: D. Uremia. Rationale: pruritus in CKD is commonly caused by the accumulation of uremic toxins in the blood. Hyperphosphatemia and hypocalcemia can contribute to skin itching, but are not the primary causes of pruritus in CKD. 92. A patient with CKD is prescribed a phosphate binder. When should the nurse advise the patient to take this medication? A. Before meals. B. With meals. C. After meals. D. At bedtime. Answer: B. With meals. Rationale: phosphate binders should be taken with meals to effectively bind dietary phosphate and prevent its absorption. Taking them before or after meals reduces their effectiveness. 93. A patient with CKD is at risk for developing bone mineral disorders. Which of the following interventions is most appropriate? A. Administer phosphate binders. B. Administer calcium supplements. C. Increase dietary sodium intake. D. Decrease fluid intake. Answer: B. Administer calcium supplements. Rationale: in CKD, decreased calcium levels can lead to bone mineral disorders. Calcium supplements help manage this issue. Phosphate binders are used to manage hyperphosphatemia, not to treat calcium deficiency. 94. A patient with CKD has been prescribed a low-sodium diet. What is the most important teaching point for the nurse to emphasize? A. Limit the intake of fruits and vegetables. B. Avoid processed foods and canned foods. C. Increase salt intake to prevent dehydration. D. Drink more fluids to balance electrolytes. Answer: B. Avoid processed foods and canned foods. Rationale: processed and canned foods are often high in sodium, which can worsen fluid retention and hypertension in CKD patients. A low-sodium diet is essential to manage fluid balance and blood pressure. 95. A patient with CKD is receiving hemodialysis. What is the most important nursing assessment immediately after the procedure? A. Assess the dialysis access site for signs of infection. B. Measure the patient's blood pressure and heart rate. C. Monitor for signs of muscle cramps. D. Evaluate the patient's electrolyte levels. Answer: A. Assess the dialysis access site for signs of infection. Rationale: the dialysis access site, e.g., arteriovenous fistula or catheter, is at risk for infection. Ensuring its patency and assessing for infection is critical. Monitoring vital signs, muscle cramps, and electrolytes are important, but not as urgent post-dialysis. 96. A patient with CKD has a glomerular filtration rate, GFR, of 20 milliliters per minute. What stage of CKD is this patient in? A. Stage 1. B. Stage 2. C. Stage 3. D. Stage 4. Answer: D. Stage 4. Rationale: a GFR of 20 milliliters per minute indicates stage 4 CKD, characterized by severe decrease in kidney function. Stage 1 has a GFR of greater than or equal to 90 milliliters per minute. Stage 2 is 60 to 89 ml/min, and Stage 3 is 30 to 59 ml/min. 97. A patient with CKD is diagnosed with hypertension. Which of the following antihypertensive medications is commonly prescribed in CKD patients? A. Calcium channel blockers. B. Beta blockers. C. Angiotensin-converting enzyme, ACE, inhibitors. D. Diuretics. Answer: C's angiotensin-converting enzyme, ACE, inhibitors. Rationale: ACE inhibitors are commonly prescribed in CKD patients to manage hypertension and protect kidney function by reducing proteinuria and controlling blood pressure. Diuretics and calcium channel blockers may also be used, but ACE inhibitors are preferred for kidney protection. 98. A patient with CKD has a serum calcium level of 6.8 milligrams per deciliter. What is the priority intervention? A. Administer calcium supplements. B. Administer vitamin D. C. Monitor for signs of hyperkalemia. D. Encourage a high-phosphate diet. Answer: A. Administer calcium supplements. Rationale: a serum calcium level of 6.8 milligrams per deciliter indicates hypocalcemia. Administering calcium supplements is the priority intervention. Vitamin D is also important for calcium absorption but is secondary to correcting the calcium deficiency. 99. A patient with CKD is prescribed sodium polystyrene sulfonate, KXLate, for hyperkalemia. What is the most important nursing consideration? A. Monitor for signs of hypokalemia. B. Monitor for signs of hyperkalemia. C. Monitor for constipation. D. Monitor for elevated blood pressure. Answer: C. Monitor for constipation. Rationale: sodium polystyrene sulfonate, KXLate, can cause constipation as a side effect. It is important to monitor for this complication. While potassium levels must be monitored, constipation is the more immediate concern with this medication. 100. A patient with CKD is receiving peritoneal dialysis. What is the most common complication associated with this treatment? A. Peritonitis. B. Hypertension. C. Hyperkalemia. D. Hypokalemia. Answer: A. Peritonitis. Rationale: peritonitis, an infection of the peritoneal cavity, is the most common complication of peritoneal dialysis. It is important to monitor for signs of infection at the catheter insertion site and within the abdomen. 101. A patient with CKD is experiencing fatigue. Which laboratory finding is most likely contributing to this symptom? A. Decreased hemoglobin. B. Increased creatinine. C. Increased potassium. D. Decreased albumin. Answer: A. Decreased hemoglobin. Rationale: fatigue in CKD patients is often due to anemia caused by decreased erythropoietin production. Decreased hemoglobin is a key indicator of this type of anemia. 102. A patient with CKD is receiving a kidney transplant. What is the most important nursing consideration after the procedure? A. Monitor for signs of graft rejection. B. Administer immunosuppressive therapy. C. Ensure proper fluid management. D. Encourage physical activity immediately. Answer: A. Monitor for signs of graft rejection. Rationale: the most important consideration after a kidney transplant is monitoring for graft rejection, which can occur within the first few weeks after transplantation. Immunosuppressive therapy is also important but should be administered as prescribed to prevent rejection. 103. A patient with CKD is prescribed a low-potassium diet. Which of the following foods is safe for the patient to consume? A. Oranges. B. Bananas. C. Carrots. D. Potatoes. Answer: C. Carrots. Rationale: carrots are a low-potassium food and are safe for CKD patients on a low-potassium diet. Oranges, bananas, and potatoes are high in potassium and should be avoided or limited. 104. A patient with CKD has developed uremic frost. What is the most appropriate nursing intervention? A. Administer oral phosphate binders. B. Increase fluid intake. C. Provide warm compresses to the skin. D. Prepare the patient for dialysis. Answer: D. Prepare the patient for dialysis. Rationale: uremic frost is a sign of severe uremia and indicates the need for dialysis. It is caused by the accumulation of waste products in the body. Dialysis will help remove these toxins and relieve symptoms. 105. A patient with CKD is experiencing nausea, vomiting, and a metallic taste. Which of the following is the most likely cause of these symptoms? A. Uremia. B. Hyperkalemia. C. Hypocalcemia. D. Fluid overload. Answer: A. Uremia. Rationale: nausea, vomiting, and a metallic taste are classic symptoms of uremia, which occurs when the kidneys can no longer filter waste effectively. These symptoms are typically seen in advanced stages of CKD. 106. A patient with CKD is receiving a potassium-sparing diuretic. What is the most important nursing action? A. Monitor for signs of hypokalemia. B. Monitor for signs of hyperkalemia. C. Encourage high-potassium foods. D. Monitor blood glucose levels. Answer: B. Monitor for signs of hyperkalemia. Rationale: potassium-sparing diuretics can cause hyperkalemia by preventing the excretion of potassium. The nurse should monitor for signs of high potassium, such as muscle weakness and arrhythmias. 107. A patient with CKD has developed pericarditis. What is the most likely cause of this condition? A. Uremia. B. Hyperphosphatemia. C. Hyperkalemia. D. Fluid overload. Answer: A. Uremia. Rationale: pericarditis in CKD patients is commonly caused by uremia. The buildup of waste products in the blood can lead to inflammation of the pericardium. 108. A patient with CKD is prescribed a low-protein diet. What is the main purpose of this dietary restriction? A. To prevent fluid retention. B. To reduce the workload on the kidneys. C. To increase albumin levels. D. To improve blood pressure control. Answer: B. To reduce the workload on the kidneys. Rationale: a low-protein diet helps reduce the kidneys' workload by limiting the amount of waste products that must be filtered. It does not directly affect fluid retention, albumin levels, or blood pressure. 109. A patient with CKD is being started on hemodialysis. What is the most important pre-dialysis teaching point for the patient? A. The procedure will correct kidney function permanently. B. The procedure will require a needle insertion site to be cleaned regularly. C. The procedure will remove waste products and excess fluids from the body. D. The procedure will require a strict dietary regimen to be followed. Answer: C. The procedure will remove waste products and excess fluids from the body. Rationale: hemodialysis removes waste products and excess fluids from the body, which is the primary goal of the treatment. While needle site care and dietary changes are important, the main purpose of dialysis is to remove toxins and excess fluid. 110. A patient with CKD has a GFR of 12 milliliters per minute. Which stage of CKD is the patient in? A. Stage 1B, Stage 2C, Stage 3D, Stage 5. Answer: D. Stage 5. Rationale: a GFR of 12 milliliters per minute indicates Stage 5 CKD, also known as end-stage renal disease, ESRD. Stages 1 to 4 are associated with higher GFR values. 111. A patient with CKD is being educated about fluid management. Which of the following should the nurse recommend to help control fluid intake? A. Limit fluid intake to 2 liters per day. B. Avoid drinking fluids during meals. C. Monitor weight daily. D. Drink fluids with meals to improve digestion. Answer: C. Monitor weight daily. Rationale: daily weight monitoring helps assess fluid retention and provides a way to track changes in fluid balance. Limiting fluid intake, while important, should be tailored to individual needs. 112. A patient with CKD has been prescribed iron supplements for anemia. What is the most important nursing consideration? A. Administer iron with food to reduce stomach upset. B. Monitor for signs of constipation. C. Encourage the patient to take iron with calcium-rich foods. D. Assess for signs of hyperkalemia. Answer: B. Monitor for signs of constipation. Rationale: iron supplements commonly cause constipation, so monitoring for this side effect is important. Taking iron with food may reduce absorption, and iron should not be taken with calcium-rich foods. 113. A patient with CKD has a potassium level of 6.2 milliequivalent/L. What is the most appropriate action? A. Administer a potassium-sparing diuretic. B. Administer sodium bicarbonate. C. Restrict potassium intake. D. Prepare the patient for dialysis. Answer: C. Restrict potassium intake. Rationale: a potassium level of 6.2 milliequivalent/L indicates hyperkalemia. The most appropriate action is to restrict potassium intake. If potassium levels are dangerously high, dialysis may be necessary. 114. A patient with CKD is receiving a phosphate binder. What is the purpose of this medication? A. To decrease serum calcium levels. B. To bind phosphate in the gastrointestinal tract. C. To reduce fluid retention. D. To treat hyperkalemia. Answer: B. To bind phosphate in the gastrointestinal tract. Rationale: phosphate binders are used to reduce phosphate levels in the blood by binding phosphate in the gastrointestinal tract and preventing its absorption. They do not affect calcium, fluid retention, or potassium levels. 115. A patient with CKD is being started on erythropoiesis-stimulating agents, ESAs. What is the primary goal of this treatment? A. To correct fluid imbalance. B. To increase erythropoiesis and treat anemia. C. To lower blood pressure. D. To decrease serum phosphate levels. Answer: B. To increase erythropoiesis and treat anemia. Rationale: ESAs are used to stimulate red blood cell production in the bone marrow, thereby treating anemia, which is common in CKD. They do not directly affect fluid balance, blood pressure, or phosphate levels. 116. A patient with CKD is being treated with a low-potassium diet. Which food should the nurse encourage the patient to consume? A. Tomatoes. B. Apples. C. Bananas. D. Potatoes. Answer: B. Apples. Rationale: apples are low in potassium and are safe for CKD patients on a low-potassium diet. Tomatoes, bananas, and potatoes are high in potassium and should be avoided or limited. 117. A patient with CKD is diagnosed with osteodystrophy. What is the most appropriate intervention? A. Increase calcium intake. B. Administer phosphate binders. C. Encourage weight-bearing exercise. D. Administer vitamin D supplements. Answer: D. Administer vitamin D supplements. Rationale: osteodystrophy in CKD is often due to imbalances in calcium, phosphate, and vitamin D. Administering vitamin D supplements helps improve calcium absorption and bone health. 118. A patient with CKD is experiencing muscle weakness. Which electrolyte imbalance is most likely contributing to this symptom? A. Hypercalcemia. B. Hyperphosphatemia. C. Hyperkalemia. D. Hypokalemia. Answer: C. Hyperkalemia. Rationale: muscle weakness in CKD can be caused by hyperkalemia, which leads to muscle and cardiac dysfunction. Hypercalcemia and hyperphosphatemia can cause other symptoms, but they are not typically associated with muscle weakness. 119. A patient with CKD is prescribed a diuretic. What is the most important nursing consideration when administering this medication? A. Monitor for signs of fluid overload. B. Monitor for dehydration and electrolyte imbalances. C. Increase fluid intake to prevent dehydration. D. Administer the diuretic with potassium supplements. Answer: B. Monitor for dehydration and electrolyte imbalances. Rationale: diuretics can cause dehydration and electrolyte imbalances, particularly hypokalemia, in CKD patients. Monitoring for these complications is essential. Increasing fluid intake is not always appropriate in CKD due to fluid retention concerns. 120. A patient with CKD is being started on peritoneal dialysis. What is the most important post-procedure nursing action? A. Monitor the patient for signs of hypotension. B. Assess the peritoneal dialysis catheter site for infection. C. Encourage the patient to drink fluids. D. Administer phosphate binders. Answer: B. Assess the peritoneal dialysis catheter site for infection. Rationale: infection at the peritoneal dialysis catheter site is a serious complication, and it is important to assess the site for any signs of infection, such as redness, swelling, or drainage. Hypotension and fluid intake should also be monitored, but the primary concern immediately post-procedure is infection prevention. 121. A patient with CKD is experiencing fluid retention. What is the most important intervention to manage this complication? A. Restrict fluid intake. B. Administer sodium polystyrene sulfonate. C. Increase dietary sodium intake. D. Administer a potassium-sparing diuretic. Answer: A. Restrict fluid intake. Rationale: fluid retention in CKD is best managed by restricting fluid intake to prevent further accumulation. Sodium polystyrene sulfonate is used to treat hyperkalemia, not fluid retention, and increasing sodium intake would worsen fluid retention. 122. A patient with CKD has a serum albumin level of 2.5 g/dl. What is the most likely cause of this abnormality? A. Increased protein intake. B. Decreased protein synthesis. C. Increased renal clearance of albumin. D. Decreased fluid intake. Answer: B. Decreased protein synthesis. Rationale: a low serum albumin level in CKD is commonly due to decreased protein synthesis in the liver as a result of kidney dysfunction. Renal clearance of albumin can be increased in conditions like nephrotic syndrome, but this is not the primary cause of low albumin in CKD. 123. A patient with CKD is prescribed a low-phosphorus diet. Which of the following foods should the nurse recommend to the patient? A. Dairy products. B. Meat. C. Whole grains. D. Fresh fruits. Answer: D. Fresh fruits. Rationale: fresh fruits are typically low in phosphorus and are recommended for CKD patients on a low-phosphorus diet. Dairy products, meat, and whole grains are high in phosphorus and should be restricted. 124. A patient with CKD is being started on hemodialysis. What is the most important teaching point regarding the procedure? A. The procedure will cure kidney failure. B. The procedure will remove excess fluid and waste from the body. C. The procedure will restore kidney function permanently. D. The procedure will improve bone health. Answer: B. The procedure will remove excess fluid and waste from the body. Rationale: hemodialysis removes excess fluid and waste products from the body, but does not cure kidney failure or restore kidney function permanently. It can help alleviate symptoms of CKD, but is not a cure. 125. A patient with CKD is prescribed a diuretic. What is the most common side effect of this medication? A. Hypokalemia. B. Hyperkalemia. C. Hypoglycemia. D. Hypercalcemia. Answer: A. Hypokalemia. Rationale: diuretics, especially loop diuretics, commonly cause hypokalemia as a side effect. Monitoring potassium levels and replacing potassium as needed is essential in CKD patients on diuretics. 126. A patient with CKD is prescribed a calcium-based phosphate binder. What is the most important side effect to monitor for in this patient? A. Hypercalcemia. B. Hypokalemia. C. Hyperglycemia. D. Hyponatremia. Answer: A. Hypercalcemia. Rationale: calcium-based phosphate binders can increase the risk of hypercalcemia. Monitoring calcium levels is important to prevent complications, such as vascular calcification. 127. A patient with CKD has developed hypertension. Which class of medication is most commonly used to treat hypertension in CKD patients? A. ACE inhibitors. B. Beta blockers. C. Calcium channel blockers. D. Diuretics. Answer: A. ACE inhibitors. Rationale: ACE inhibitors are commonly prescribed for hypertension in CKD patients because they help lower blood pressure and protect kidney function by reducing proteinuria. 128. A patient with CKD is experiencing swelling in the legs. What is the most likely cause of this symptom? A. Hyperkalemia. B. Fluid retention. C. Hypoglycemia. D. Hypocalcemia. Answer: B. Fluid retention. Rationale: swelling, especially in the legs, is a common sign of fluid retention in CKD. The kidney's inability to excrete excess fluid leads to its accumulation in the body. 129. A patient with CKD is receiving peritoneal dialysis. What is the most important aspect of patient education for managing the procedure at home? A. How to prevent infection at the catheter site. B. How to increase dietary sodium intake. C. How to monitor blood pressure. D. How to increase fluid intake. Answer: A. How to prevent infection at the catheter site. Rationale: preventing infection at the catheter site is critical for patients performing peritoneal dialysis at home. Infection can lead to peritonitis, a serious complication. 130. A patient with CKD is experiencing nausea and loss of appetite. What is the most likely cause of these symptoms? A. Uremia. B. Hyperkalemia. C. Fluid retention. D. Hypoglycemia. Answer: A. Uremia. Rationale: nausea and loss of appetite are common symptoms of uremia, which occurs when waste products accumulate in the blood due to decreased kidney function in CKD. 131. A patient with CKD has developed peripheral edema. What is the most likely cause of this complication? A. Increased calcium levels. B. Decreased protein intake. C. Fluid retention due to kidney dysfunction. D. Increased sodium intake. Answer: C. Fluid retention due to kidney dysfunction. Rationale: peripheral edema in CKD patients is commonly caused by fluid retention, which occurs when the kidneys are unable to excrete excess fluid effectively. 132. A patient with CKD is prescribed a calcium carbonate-based phosphate binder. What is the most important side effect to monitor for? A. Hypercalcemia. B. Hypokalemia. C. Hypoglycemia. D. Hypertension. Answer: A. Hypercalcemia. Rationale: calcium carbonate-based phosphate binders can increase calcium levels, leading to hypercalcemia. Monitoring calcium levels is crucial to prevent complications like vascular calcification. 133. A patient with CKD is on hemodialysis. What is the most important action the nurse should take before the procedure? A. Assess the dialysis access site for patency. B. Administer a dose of phosphate binders. C. Weigh the patient to monitor fluid status. D. Give the patient a sedative to ease anxiety. Answer: A. Assess the dialysis access site for patency. Rationale: ensuring the dialysis access site, e.g., arteriovenous fistula or catheter, is patent before starting hemodialysis is critical for the success of the procedure. 134. A patient with CKD is experiencing shortness of breath and fatigue. Which of the following complications is most likely contributing to these symptoms? A. Anemia. B. Hyperkalemia. C. Hypocalcemia. D. Hyperphosphatemia. Answer: A. Anemia. Rationale: anemia is a common complication of CKD due to decreased erythropoietin production by the kidneys. It can lead to symptoms such as shortness of breath, fatigue, and weakness. 135. A patient with CKD is receiving epoetin alpha, Epigen, for anemia. What is the primary goal of this treatment? A. To decrease serum potassium levels. B. To stimulate red blood cell production. C. To decrease phosphate levels. D. To improve calcium absorption. Answer: B. To stimulate red blood cell production. Rationale: epoetin alpha, Epigen, is an erythropoiesis-stimulating agent that helps increase red blood cell production in patients with CKD-related anemia. 136. A patient with CKD has been prescribed a potassium-sparing diuretic. What is the most important nursing consideration? A. Monitor for signs of hypokalemia. B. Monitor for signs of hyperkalemia. C. Monitor for signs of fluid retention. D. Monitor for hypercalcemia. Answer: B. Monitor for signs of hyperkalemia. Rationale: Potassium-sparing diuretics can cause hyperkalemia by preventing the excretion of potassium. The nurse should monitor the patient for signs of high potassium, such as muscle weakness, fatigue, or arrhythmias. 137. A patient with CKD is receiving peritoneal dialysis. What is the most important nursing intervention to reduce the risk of peritonitis? A. Keep the catheter insertion site clean and dry. B. Administer antibiotics as prescribed. C. Encourage the patient to increase fluid intake. D. Monitor for hyperkalemia. Answer. A. Keep the catheter insertion site clean and dry. Rationale. Preventing infection at the catheter insertion site is crucial in reducing the risk of peritonitis, a common complication of peritoneal dialysis. 138. A patient with CKD is experiencing nausea, vomiting, and a metallic taste in the mouth. What is the most likely cause of these symptoms? A. Hyperkalemia. B. Uremia. C. Hypoglycemia. D. Fluid overload. Answer. B. Uremia. Rationale. Nausea, vomiting, and a metallic taste are classic signs of uremia, which occurs when waste products accumulate in the blood due to kidney dysfunction. 139. A patient with CKD has a serum phosphorus level of 7.5 milligrams per deciliter. What is the most appropriate intervention? A. Administer phosphate binders with meals. B. Increase dietary phosphorus intake. C. Administer a potassium-sparing diuretic. D. Restrict protein intake. Answer. A. Administer phosphate binders with meals. Rationale. Phosphate binders help reduce phosphate levels in the blood by binding phosphate in the gastrointestinal tract and preventing its absorption. 140. A patient with CKD is prescribed a low-protein diet. What is the rationale for this dietary restriction? A. To increase albumin levels. B. To reduce the kidney's workload. C. To lower blood pressure. D. To prevent fluid retention. Answer. B. To reduce the kidney's workload. Rationale. A low-protein diet reduces the kidney's workload by minimizing the amount of waste that needs to be filtered. This can help slow the progression of kidney disease. 141. A patient with CKD is receiving a calcium-based phosphate binder. What is the most important laboratory test to monitor? A. Calcium level. B. Potassium level. C. Creatinine level. D. Hemoglobin level. Answer. A. Calcium level. Rationale. Calcium-based phosphate binders can increase calcium levels, so it is important to monitor calcium levels regularly to prevent hypercalcemia and related complications. 142. A patient with CKD is receiving diuretics. What is the most important electrolyte imbalance to monitor for in this patient? A. Hypokalemia. B. Hyperkalemia. C. Hypernatremia. D. Hypocalcemia. Answer. A. Hypokalemia. Rationale. Diuretics, especially loop diuretics, can cause hypokalemia as a side effect. Monitoring potassium levels is essential in CKD patients on diuretics. 143. A patient with CKD is receiving antihypertensive medication. Which class of medications is commonly prescribed to protect kidney function? A. Angiotensin-converting enzyme, ACE, inhibitors. B. Beta blockers. C. Calcium channel blockers. D. Diuretics. Answer. A. Angiotensin-converting enzyme, ACE, inhibitors. Rationale. ACE inhibitors are commonly prescribed in CKD patients to manage hypertension and to protect kidney function by reducing proteinuria and controlling blood pressure. 144. A patient with CKD is prescribed sodium polystyrene sulfonate, KXL8, for hyperkalemia. What is the most important nursing consideration? A. Monitor for signs of hypokalemia. B. Monitor for signs of hyperkalemia. C. Monitor for signs of constipation. D. Monitor blood pressure. Answer. C. Monitor for signs of constipation. Rationale. Sodium polystyrene sulfonate, KXL8, can cause constipation as a side effect, and this should be monitored closely. Potassium levels should also be monitored, but constipation is a more immediate concern with this medication. 145. A patient with CKD is diagnosed with stage 4 kidney disease. What is the primary goal of care at this stage? A. Prevent the need for dialysis. B. Improve the patient's quality of life. C. Promote renal regeneration. D. Cure the underlying cause of CKD. Answer. B. Improve the patient's quality of life. Rationale. At stage 4 CKD, The focus is on improving the patient's quality of life by managing symptoms and complications as renal failure is progressing. Dialysis may eventually be needed, but the goal is not to prevent it at this stage. 146. A patient with CKD is experiencing fatigue and weakness. Which of the following laboratory findings is most likely contributing to these symptoms? A. Decreased hemoglobin B, increased creatinine C, increased calcium D, decreased potassium. Answer. A. Decreased hemoglobin. Rationale. Fatigue and weakness in CKD are commonly caused by anemia, which results from decreased erythropoietin production by the kidneys. This leads to a decreased hemoglobin level. 147. A patient with CKD is being prepared for dialysis. What is the most important nursing intervention? A. Ensure the patient has a signed consent for the procedure. B. Explain the procedure and potential complications. C. Administer pain medications before the procedure. D. Monitor vital signs throughout the procedure. Answer. B. Explain the procedure and potential complications. Rationale. Educating the patient about the dialysis procedure and its potential complications is critical for informed consent and for preparing the patient mentally and physically for the procedure. 148. A patient with CKD has a serum creatinine level of 5.8 milligrams per deciliter. What is the most appropriate nursing intervention? A. Administer sodium bicarbonate to reduce acidosis. B. Monitor for signs of uremia. C. Administer a potassium-sparing diuretic. D. Restrict calcium intake. Answer. B. Monitor for signs of uremia. Rationale. A serum creatinine level of 5.8 milligrams per deciliter indicates significant kidney dysfunction. The nurse should monitor for signs of uremia, including nausea, vomiting, and mental status changes, as these are symptoms of advanced kidney disease. 149. A patient with CKD is experiencing a reduced urine output. What is the most likely cause of this symptom? A. Increased fluid intake. B. Kidney damage leading to reduced filtration. C. Hyperkalemia causing decreased urine production. D. Increased sodium retention. Answer. B. Kidney damage leading to reduced filtration. Rationale. Reduced urine output in CKD is often a result of kidney damage, which decreases the kidney's ability to filter and excrete waste and fluids. 150. A patient with CKD has developed metabolic acidosis. What is the most appropriate treatment for this condition? A. Administer bicarbonate to neutralize excess acid. B. Restrict potassium intake. C. Administer phosphate binders. D. Administer erythropoietin. Answer. A. Administer bicarbonate to neutralize excess acid. Rationale. Metabolic acidosis in CKD is treated by administering bicarbonate to neutralize excess acid in the blood, helping to restore the acid-base balance.